College of Medicine. Let me also say that Dr. Asafo is one of the champions of Employee Assistance Program in Ghana and does a lot of corporate trainings in mental health and wellness. You're welcome, Dr. Asafo. So happy to have you here. Next on my list is Dr. Ernest Enim Opari. You're welcome. And he is a family physician with a passion for excellence in primary care, clinical research, sports, exercise, and rehabilitation medicine. So his career blends frontline medical practice with leadership in sports medicine, public health education, and academic research. Currently, he is a fellow in training at the Ghana College of Physicians and Surgeons, and he previously served as a deputy chief resident at the polyclinic of the Korle Teaching Hospital with the family medicine department. Dr. Opari is also a chief medical officer for the Ghana Olympic Committee, and he had the honor of leading Ghana's medical platforms. It is good to know that he is also a Reverend Minister with the Victory Bible International Church. You are all welcome to today's discussion. So we'll not waste time, we'll go straight into our discussion. We are looking at mental health, chronic illnesses at the workplace. And I want to begin with the family physician. What is the understanding of chronic illnesses? How do we explain chronic illnesses to our audience?
Good afternoon to our viewers, and thank you very much for having me. So with regards to definition of what chronic illnesses are, the World Health Organization defines chronic illnesses, or also referred to as non-communicable diseases, as a group of diseases that are as a result of either a combination of genetic factors, physiologic factors, environmental factors, and behavioral factors. But the key thing is that these conditions usually run a long course, as opposed to other conditions that may run a relatively shorter course. There is no definitive period that is put on these conditions, but as we well know, conditions such as cardiovascular So we would have to now aggregate all the data and say the number of people who have cancers, the number of people who have cardiovascular diseases, number of people who have diabetes, and other people who have chronic respiratory conditions. But we know that averagely, if you selected 3 workers at random, at least one of them would have one medical condition, which is chronic or otherwise. Yes.
Right, thank you. And we are 4 on stage, so if I should take myself out and count 1, 2, 3, maybe one of us,
that's what it means.
Right,
yes.
right. Thank you so much for that explanation for us. Dr. Pipim, you are a psychiatrist, and I want you to help us understand the issue, the burden of mental health. I mean, if you can even lay the foundation for us, what is mental health? Because I also do a lot of advocacy and mental health. Once you mention mental health, everybody's thinking, but I'm not crazy. Is that what it means?
Thank you very much for the question. It's indeed important for us to know the definition of mental health. And first of all, health. The World Health Organization defines health as a state of well-being in which every individual, the mental health. The World Health Organization defines mental health as a state of well-being. And when you consider mental health conditions, they are also chronic conditions. So an individual may have to live with chronic conditions, mental health conditions for a long period of time, and it can pose a form of disability. Depression is currently the leading cause of disability worldwide. So it is important for us to know what mental health is, and it's important for us to know that it causes a huge burden to the society. Thank you.
Thank you very much for that, explanation. I think it's very in-depth. As I was listening to you, I was beginning to diagnose myself if I have any mental health issues, because I heard you mention not even being able to contribute to society. It means that you might have a problem, because we are supposed to contribute. And so even in the workplace, it means that if I'm not able to contribute as I should, then there should be an issue concerning my mental health that needs to be addressed. Thank you so much. Dr. Asafo, I'm just trying to understand now. Dr. Pepem has helped to lay that foundation, but I want us to link then the correlation between mental health and chronic illnesses in the workplace.
Well, largely, I would say that the link between chronic illnesses and mental health stems from a very integral single characteristic of what we call stress. By and large, if you look at many of the non-communicable diseases, we also call them lifestyle disorders. And many lifestyle disorders are brought up by sometimes lifestyles that we take on, either intentionally or even not intentionally. And I always make this joke about what it's like in the modern world when people see you and to show a sign of, I'm a big boy. They'll say, can you imagine this whole year, I've only slept 3 days.
Oh, wow.
You know, it just goes on to you, like re-emphasize the things about. Every stressor is experienced as a certain kind of danger to which the body tries to adapt. And the body has a system that has to deal with stress, or that is what I call our survival system. Now, this system is made or was made to act in very short term. So if I'm in danger, I have a wild creature after me. I need a few minutes to dodge the creature, or the creature will finish me off. Except that in the modern sequence of stress, many of the stresses are quite mental. So you are not seeing the danger, but your body is responding. So you are responding to this perpetually for months to years, and a system that should work for a short period of time is working almost like there's no rest. And that has been shown, I mean, in several disorders, I mean, so many of them, that there's a huge link between the way we deal with stress, which is embedded within mental health, except that the modern stressor, we don't physically see, but we respond to many of these still physically. Let me make something a little practical. So think about the stress response as responding to a danger. So in a danger, I'm being pursued by a wild creature and I'm fleeing, okay? Now, at the same time, I'm a woman and I'm trying to give birth. But my body understands that I'm in danger. So my body then says, this is not a wise time to conceive. So sometimes people are going through so much stress and they are not able to conceive. And it's simply from that connection of the brain makes sense of this is where we are. This is not the time. Now, practically, I am being pursued by a wild creature. At what point in that chase do I stop and tell the creature, oh, I beg, can you hold on? I want us to have sex and I can continue. Can you hold on? I want to eat and we continue. Can you hold on? I want to finish my work. So as these processes go on, a lot of other aspects of our life seem to become almost stagnant in a certain sense. And that we have known to be one of the main characteristics for causing the onset, maintaining, or even exacerbating many of the chronic disorders. Thank you.
Wow, wow, wow. Thank you so much. So then, I mean, I hear a lot of people go around and say, I'm stressed and I'm stressed and I'm stressed. It means that these people really, we need to pay attention to them. Or is it that they don't understand what stress is then? Well, I think that probably there are levels of stress, and maybe for them it's quite the short term and might not be what will put them in so much danger.
And stress is a very subjective thing.
Wow.
So in every stressor, what we do know is that if I consider that I have the resources to deal with it, it's not stressful, which also means that my survival system may not kick in. And I always tell people, don't trivialize someone's stress. We like this concept of, I come in and I say, oh, Auntie Anna, this is what is happening. Then you say, oh,
just this one.
My own. So then, before you know, the person now starts to look at it as if maybe I don't have an issue, but they actually do have an issue. So stress is very subjective. What I might consider to tip me off might not do same for you, and it's okay. Because it also boils down back to the issue of resilience that you were talking about.
But is stress, before I let you go, is stress bad in itself? Is it a bad thing to be stressed?
At all. So the thing is that stress is necessary for survival.
Okay.
We need the stress to be able to build resilience. That's the first thing. And I always use the example of what it's like to go to the gym or to go and exercise. When you go to the expansion is happening, so there's growth of some sort. Same thing happens when we deal with life's challenges. The challenges open us up to problem solving and coping strategies that allow us to be able to deal with others. Now, when stress is dangerous is when the stress is chronic. It doesn't go away. So, for example, you're in an abusive relationship. Every day there's abuse. That kind of stress is chronic and will almost lead you into a dip. Now, when you have accumulation of stress also, that's a problem. So you may have different things. But, so in the morning, you're thinking about traffic, your children's will.
I just want to acknowledge those who have joined us online. And if you just joined us, you are here live on the Korle webinar series. The first in 2025, we are discussing mental health and chronic illnesses at the workplace. Thank you so much for joining. Yeah, Dr. Pippin.
Thank you. I want to share some personal experiences
Please go ahead.
with people living with chronic conditions and mental health.
Right.
Because of where we are, we liaise with different departments. So chronic conditions, medical conditions, cause a lot of burden. And imagine someone having diabetes, hypertension, they have to be on medications for a long period of time. And this is in itself is very stressful. Living with the condition is stressful. And then the financial burden, they don't have any private insurance or even health insurance. Then they are going to spend a lot of money, their lives. I mean, it's for life. Diabetes, hypertension. So living with chronic, non-communicable diseases is a burden. And
Opare, Dr. Apia, because she works in the hospital, so give us an example of what we see on the ward. But you do all other things also. For someone like this, the example she's just gave, who is at the workplace, not working in a health institution. So someone is working in a bank, is working in an oil and gas industry, is working elsewhere with this diagnosis. What can the organization do to support such a person?
Okay, so I can appreciate the context that it's not an easy situation, first of all. And like Dr. Mausi said, Asafo, you would not like to box everyone in one situation. People can manage even more than such diagnosis and still be functional at work. So you would first want to understand what the situation is in that person. And that's what we do in family medicine. We make sure that in trying to see the patient, we approach the patient from what we call a 3-tier diagnosis, which means we are doing the biopsychosocial. So typically the biological diagnosis will be hypertension, diabetes, prostate. And then you come to the individual diagnosis. What does the patient feel about the condition? What ideas does the patient have about the condition? How is the condition affecting their function or otherwise? And then what are their expectations from the management? If you're able to go through these 4 areas, that gives you the individual diagnosis. The next tier of diagnosis is what we call the contextual diagnosis. Because even before we fall to the organization at work, we live in a system, in our world, yes, first of all, in this particular Ghana, as we have it, you have people who have very close family ties. So even before you look at workplace, I believe that having gone through the 3-tier diagnosis, the biological, the individual diagnosis, the contextual, it tells you, for instance, is this patient married or not married? Does this patient have children or no children? Does this patient live alone? Can they fall on some family support? When that is done, then typically you would want to give a correspondence with the consent of the patient to their facility. Because sometimes the issue is that the same patient who you are thinking about giving an excuse duty for, because of the economic conditions, may want to go back to work, as opposed to you saying that, I think you are sick, you need to be at home. And the reverse is true, where people you would say have maybe a single diagnosis, just hypertension, you would say, but would not like to go back to work because probably the stressor is coming from work. And those people would require that medical support to be able to excuse them from duty and receive mental health support from either the psychiatrist or the psychologist, or many a time a multidisciplinary team. So my answer to that question with regards to what organizations can do is that, first of all, maybe we'll get there much later, is the screening. We're able to screen the well-being of our employees. With that one, you're able to get the diagnosis early, and by getting the diagnosis early, it means that you are less likely to suffer more severe complications, which means there will be less hospitalization, there will be less intensive management. And also, with the early screening, includes screening for psychological stresses, and they are well-validated tools, like Dr. Asafo mentioned. So people perceive stress differently. You can have two people in the same department, but one, I mean, their working hours is the same, job description is the same, but one is more stressed than the other because perhaps the way they perceive the demand of the work, the ability to cope, like has been said, or have very good defensive mechanisms all in picture. So it's very difficult to say a one-fit-all solution, that this person has a diagnosis and so write a letter and say 6 months off. Another person can have the same condition and will need just 2 weeks off. So it depends on the context of the patient.
Thank you so much. And I saw you got so excited into it and going, thank you so much. And when you mentioned it, it just reminded me of a case we had, but that one was with Lassa fever. So that was an infectious disease. And I remember we had some staff from the mortuary unit who had tested positive, and I had spoken to them that they should stay off work. But you know that these people, every day when they come to work, they have some motivation because people will come for their bodies and all that. So me telling him to stay off work was not a good news for him. So I remember I called the following day to check up on him, and he said, "Oh, but madam, me So yeah, thank you so much for that. Yeah, that took us a bit ahead of our discussion, but it was because of the point that came in. Now, I want us to look at what is changing, because you gave the statistics that, I mean, the few of us here, if we count 1, 2, 3, one person has a chronic illness. So what are some of the things that are changing, the changing trends at the workplace that is increasing chronic illnesses at the workplace? And any of you can pick that.
So in the advent of COVID, there were a number of very interesting things that we started to notice across board.
Okay.
And that was because for the first time, almost legally, people were taking their work home. And I used to paint this picture of asking people, how many of your colleagues would you allow into your bedroom? And then they say, oh, never, I don't want anyone. I say, oh, but you are there. By taking your laptop into your bedroom, by taking your... And we tended to recognize that in that moment, especially in the advent of remote work, a lot of people are working beyond their usual thresholds of work.
True.
It's almost like there's no limit, which also means that their stresses have gone up a little more than usual. For instance, even when you are off work and you get an email from work, many of us are likely to just open it. And then the moment you open that email, you are looking at queries of things that you are supposed to do. So the downtime of rest becomes another uptime of activity, essentially. Now, if you look at the way the human system is connected, it's so intricate, and it always attempts to balance itself out. So what happens is, when one system goes out of balance, it has a ripple effect on all the other systems. And I'm going to use the same stress again. So, for example, many stresses, like I explained, the response is physical. So I am going through a stressor, and it's probably a demand at work. My heart starts to beat. That heart beating is because the brain is explaining it as, I'm in a dangerous situation. So my heart needs to beat to pump more blood into my muscles to allow me to flee from the danger or to deal with it, which is the fight or flight in primitive terms. Now, during that same time, okay, your brain says, well, we are in danger, physical danger. So this is not the time to be thinking about malaria and its brothers and sisters. So your immune system, so the body tries to prioritize, okay? So then your immune system comes down, its power comes down, it takes some of the energy and pumps it to the muscles. At the same time, like I mentioned earlier, in that state, hunger is almost curbed. So in the past. But today you are not driving. So 7 o'clock, you turn on your computer and you say, I'm watching television. You lie. All these thoughts are still there. And we came to notice how significant it had been until many people became conscientized of you have to be intentional. So like in the modern world of, because if you're not being intentional, you are usually not doing anything that would enhance your health even further. Now, we believe that your health is on a continuum. It's like a ladder. There are things you can do to increase your health and things you can do to decrease your health. So based on intentionality, I mean, I always ask people, how many of us have a plate of food and then we say, okay, so this one is to give this particular vitamin or nutrient to this part. How many of us do that? We eat because we have to eat. So the intentionality is not entirely there. So what I noticed is that the advent of remote work and also technological advancement, the stresses that people are going through are increasing and are more frequent than before when there were physical barriers to make people rest and give us some way to recuperate the losses of the day. So that is my perspective.
Well, thank you. And if you just join us, this is a reminder that you are live on the Kolebu webinar series. We are discussing managing mental health and chronic illnesses at the workplace. I have with me here Dr. Asafo, I have Dr. Apia Pipim and Dr. Opare discussing this relevant topic with me. Dr. Apia Pipim, I want us now then to link chronic illnesses. We have established that it can have an effect on our mental health, but even our mental health can also have an effect on our chronic, just as has been explained. So, for instance, I'm stressed and that is why I'm getting hypertension. I'm stressed, and that's why probably I'm forgetting to even adhere to my medication, and so my situation is getting worse. Does it have any effect at the workplace on my job performance and productivity?
Thank you very much. Indeed, all the chronic conditions, medical condition, has an effect on one's mental health, as I have already mentioned, that they are very stressful conditions. I mean, having to live with some of these conditions for life, having to pay bills and all that. Your finances will also go down if you do not have any insurance from your company protecting you or supporting you. It is very stressful. Financial, it's called pocketitis. That's what it's There's a financial burden. And if people would want to cope with the stress, so they may get into unhealthy coping mechanisms like substance use. Substance use disorder, like taking a lot of alcohol, you know, indulging in illicit drugs. And this can have an effect on their productivity because it makes them absent from work, or they may even be present at work but not working, not being productive. Presenteeism. So all the mental health conditions, even if you develop depression out of living with a chronic medical condition, it has an effect on your productivity because in severe depression, an individual becomes very slow. They can't concentrate, they make errors, and they risk being fired from work. And that is also very stressful. Recently, I had a patient I was managing, dying by suicide because he was laid off from his job because of unproductivity.
Wow.
And he was living with a mental health condition, but the company does not make room for unproductive people. So, without getting advice from anybody, they laid the guy off. Within 2 days, the guy ended his life. So this shows that mental health conditions have an effect on productivity. And therefore, it is important for workplace, the HRs, the organizations to look at mental health policies around work. So even somebody who does not have a diagnosed mental health condition, having a chronic medical condition, is at risk of having a mental health condition. So it has to be ingrained in there so that it is managed holistically to prevent all these losses. So unproductivity does not even affect only the individual, but his family and the company
given out. But one very popular way that we use in family medicine is looking at the individual from one stage to the other, where you have the stage where they are now getting into adulthood, which is usually the emerging phase. And so they have just finished university, they have finished perhaps they've even finished their national service. That is one phase, and getting employed. The stage 2, which is the crystallizing phase, is where they have now gotten to a point where they are getting married. Stage 3 is the transition phase where they have young children. Stage 4 is the forming stage where the young children are now adolescents. Stage 5 is what we call the empty nest. They started off being young, bubbly. Now the children have come through. They were adolescents at a point. Now the children have left them just like they left their parents at a point. And stage 6 is where they are post-retirement stage. It's not just some emptiness, but they are almost dependent on other people. And each of these stages in the family cycle have particular risk. So take the first stage where it's emerging. They are now in emerging phase where perhaps they are not married, they are going about their duties, they don't have any commitment. They say, oh, let's go out and drink, they drink. Let's go out and eat, they eat. Let's go out and do this. They do anything, and they are more likely to be indiscriminate. And as a result of this, they may engage in behaviors that will increase risk. Probably they are not engaging in enough physical activity. Then they start building metabolic risk factors like high blood cholesterol. They could have increased weight or obesity, overweight, amongst other things. Stage 2 is when it's crystallizing. They are just married. There are other stresses. So now they are living with another person in addition to their job expectation. So they may be a quiet person, but now they have to meet their partner, their husband, their wife, and that imposes another stress on them. When you have the adolescent, the next stage is the transition phase. Remember, they were first alone, now they have a spouse, now they have children. That gives them risk factors. And we said early on, more stress, in quotes. We said early on that about a third of all workers would have one medical condition, which is chronic or the other. So in this context, it could be they themselves, it could be their partners, or in some cases, even a child can get that condition. And as a result of that diagnosis, they may be losing time at work to either take care of their spouse or take care of their child who may have a chronic condition. And then going down the cycle, you realize that there's an emptiness, which is a big challenge, because now they may have a chronic medical condition, but they can't even get somebody to bring them to the hospital, depending on how much this chronic medical condition has affected their functionality. So you realize that family progress or family cycle has a direct link with the chronic medical condition. As you age and as you go into the field of work, these are certain variables or mediators that come to play and may either aggravate or make it better. Because even though I said it's a potential stressor, if you have a very good family support, a family that can be around when you have to go for your regular visitation, regular drug refill, regular checkups, then it becomes even a point where the family gets together and supports you. Because it's an enabling environment that supports you. Yeah. But I must admit that it is potentially disabling, because if they have to go out of their work and send daddy to review every month and all of that. So this is the interplay of factors. The same individual, but at different stages, there are different factors that come into play that can be either disabling or enabling for that individual in the context of work.
Wow. Thank you so much for that. Dr. Asaf, I don't know if you want to add.
What I wanted to touch on is that if you look at the generations, there are a number of traits that puts them at risk and a number of traits that are positive in a sense. And I want to highlight very specifically the Gen Z population, which will be followed by Gen Alpha and then recently the X. And what we do find is within many corporate circles, they talk about the fact that those cadre of workers, they seem not to be bothered by anything. They listen like, I'm tired, me, you are worrying me, that whole thing. And it's a transitional thing. Now, what do we see in today's world? As many parents attempt to take good care of their children, they do one grave error they don't recognize. They solve their children's problems for them.
True.
So the children do not build the context of problem solving. And so at the face of the least challenge, they throw their hands up like, I can't do this anymore. And that has a lot of significance on both their mental health and In terms of, I'd say that they are intellectually gifted, but socially, they don't have anything. So a lot of stresses push them to meltdowns very, very quickly. And that's something that we need to look at, even as we employ. It's like developing programs that are able to...
Specific targets.
Exactly. Thank you.
Right. And thank you so much. I could relate to the example that you gave because I remember sometime I went to visit my mom with my daughter and I wanted her to do something for me. And as she was doing it, I was like, oh, but take it easy,
Any chronic condition can be a bit stigmatizing. And there's a lot of discrimination around it. And people are also in denial with the various conditions. So it is very difficult for them to come out to inform their employers that they have certain conditions. I mean, it's even better with the medical conditions. The mental health conditions is very, very stigmatized. It's like a no-go area. I mean, I wonder how many of us would boldly take that we have a problem, like a mental health problem, if we do, and when we are going for a job, a new job in the first place, because of the stigma attached to mental health and the discrimination and all that, it is very difficult for people to come out to mention that they are living with a mental health condition. But I think that by and large, sensitization is going on, awareness creation, people are now more comfortable, mentioning that they have issues. Like, for instance, the gentleman in reference that I mentioned who lost his life to suicide, he told his company that he was living with a condition, but I was pretty surprised that the HR did not reach out to us to find out what the issue was. Do you see? But there's zero tolerance for unproductivity.
Wow.
And when it's like that, people would always shield, hide certain conditions, because in actual fact, people may be prejudiced about it, that you live with a mental health condition, so you can't do anything. I mean, they don't take your opinions. They don't take you when you go for meetings and you speak, no, papa, like, is to it as and she said, no, I'm not in the mental line. And that person who asked her the question has been living with bipolar for a long time and has accepted it, and he was very stable. So to the best of his knowledge, she's asking for the queue. So that I sit.
Okay, so
next
she could
to
join.
you.
Wow.
The woman was very furious, like, no way. Why did he have to ask me where the mental line was? And I was like, this is very stigmatizing. But with awareness, people are confident and they're able to, I'm going to see the psych, I'm going to see the mental health specialist. So we have to do more awareness creation. We have to go into the corporate space and educate them, and also make employees living with chronic conditions, including mental health conditions, very comfortable about seeking help. Thank you.
Thank you
Let
so
me just
much.
add something
So
small.
before you add, I just want to acknowledge participants who have joined us online that we are live on the Kolibu webinar series, the first in 2025. Today we are discussing managing mental health and chronic illnesses at the workplace. You can put your comments and your chats and your comments and questions in the chat box. Thank you so much.
Yeah, so I was just going to add about this apparent stigmatization that exists. Like she said, it's even worse with, as it were, mental health conditions. I think the primary goal of for instance, pre-medical employment, it's not so much to do with a categorical binary classification as whether you are fit or not fit. There are times where somebody, an employee could be fit, but for a particular role. So like she cited, there could be roles that based on the assessment, we could say you are fit, but in the context of your situation, you cannot do A, B, C, D. But because people are scared that they have applied for a particular job role, and if this pops up, I will be denied this role, then they are going to keep it. I had a good side, or maybe a good ending to a similar experience where one employee was laid off, but he demonstrated, not physically, but some anguish and some disappointment the very moment the letter was handed, that the employers were scared. They got in touch with a medical expert and then had to be evaluated by a psychologist, a medical personnel attached to the HR team. Because when it comes to work, and it's not just about your capacity in terms of your academic qualification. Sometimes just by reason of your some biological deficit, you cannot be able to work as much. And it can be arranged and say, okay, your limit is this. Yeah. So we are going to pay you a proportion of this because this is where you get your limit based on other stresses, rather than try and put in there, like you said, presenteeism. The person is there but has gotten to their threshold and they are unable to work further.
Right, thank you. So that point that you made is what we call also reasonable accommodations at the workplace, right? There's a comment online that I wanted to read. Someone, Nana Belson, says that, what if you voice out but you are seen as someone who is acting up? It ends up making you not talking about what is bothering you. Sometimes at work, you are seen to be lazy, right? To be lazy, right? I saw that you grabbed the microphone. I know. Yeah, please. You wanted to ask a question.
That's okay. I mean, we can continue.
But I think we can.
Yeah, we can.
Yeah, I think we can.
The scenario,
Yes.
your case,
Yeah,
you
the
had
better-
a better
outcome.
outcome.
Not because
I
I'm
wanted
clever.
to find out the age of the employee.
So this was a middle-aged man. This was a middle-aged man who he said he was going to commit suicide. And so the HR...
Threatened them.
Yes, he threatened them. The HR was concerned and got in touch with a medical expert who got in touch with me. And then immediately we had to have, because he was far off, we had to have an online session and then arrange for an in-person. But moving forward, we made a suggestion that you cannot just, based on your HR policies, you may decide that this person cannot go on with the role. But it doesn't mean that it lies within your purview to hand over a letter without any mental preparation and exit interview and all of that. So it became very, very, very important for them. So gradually we are getting there. Hopefully it will become fully integrated in some of these workplaces.
Yeah, and I think it's also the problem we have at the workplace, for me as an occupational health and safety practitioner, is the fact that as a country, we do not have a bill to support health and safety at the workplace. And so I see companies, well, the multinational companies do their best. They do a lot when it comes to health and safety at the workplace. But when you come to the local organization, even the civil service, we don't have policies and protocols really to protect the health and safety of people at work. I don't know if you wanted to make a comment.
That also buttresses the point that the older generation have more resilience, because my case was a 27-year-old, and he couldn't cope with the stress. This was a young pharmacist.
Wow.
So it was very emotional, it was challenging. I think that he swayed them off. He did not give any inkling that he was going to do that. So we should look at it and look at it. But I think we'll come to that and look at the mental health policies around work. Okay.
Yeah. So in fact, that's the question that I'm coming to. I wanted to begin with Dr. Asafo, but I don't know if you want to take it. I want to understand if, as a nation, we have laws, mental health policies that protect people at work. And for people at work, mainly if we can also look at people with chronic illnesses at the workplace.
So I'll deal with the mental health aspect. So the Mental Health Act, we have the Mental Health Act 846, Section 68 or 63, talks about employment rights for persons with mental health conditions, that an employer must not terminate someone's appointment or contract or work based on a mental health challenge. If they have any cause to think that the person has a challenge and therefore cannot perform at the role, they have to get the employee help. They have to get the employee help. And then, whilst the person is receiving help, move them to a role that is suitable for their function. If, after that, that the person is still unproductive, then they can go on to terminate, but they have to follow the labor laws of the country. You don't just terminate somebody. The appropriate remunerations and all that have to be given to the person according to the human rights and all that in the labor law. And then also it is important, I mean, in the Act, the Employment Rights also mentions that it's important for employers to take care of the mental health of their employees, get them help. If you think that it's an emergency, then you need to follow what you call the certificate of urgency. You need to send the employee to the psychiatric hospital or any hospital close by, and they'll be referred to the psychiatric hospital. And within 48 hours, they have to be managed. And beyond that, then they would have to apply to the court for prolonged treatment, involuntary court order. So there are laws there, but I don't think that a lot of companies are aware of it. Some companies are doing well, they are on top of the...
I mean, clearly, like Dr. Pim was saying, there are protective mechanisms, except that they are not well defined. So there's a lot of subjectivity in trying to explain and implement it. But we have come from far. Where we are is not bad. Now, in my opinion, sometimes when we have these conversations, employers feel like we are taking sides of employees. But the reality is, if the employer is aware of this, it allows them to also be protected because there are responsibilities the employer owes the employee and the employee owes the employer, and that's why I think it's important. Now, the second thing is there's always a lack of information sharing on these concepts, so people do not know, and so they can act on their own accord. I remember we had a full-blown intervention in one of
in place to protect employees who have chronic illnesses, because the fact has been established that for every 3 persons at work, 1 has a chronic illness. So yes, we can do all the advocacies to stop chronic illnesses, but the fact is that people have chronic illnesses. Now, how can we, what are some of the interventions that we can put in place to protect their mental health and ensure their productivity?
I want to start.
Okay, so you can start and then it can go in that direction.
So,
and if you can look at that from an organizational perspective, an individual perspective, and then the work community perspective, I'll be happy.
So I know that you are mentioning those who already have the condition.
Yes.
But I want to say that the best protection is the prevention.
Prevention.
So let's make sure we don't get there.
Okay.
Now, I see a lot of corporates now incorporate like physical activity into their day. They have personal trainers who come to do aerobics with them. And I think that's amazing. I see in some institutions that we have been to, basically they have charts of food. Like when you go to the canteen, they'll say, oh, this one, a balanced diet should be made up of 1 unit of this, 2, and those are amazing preventive techniques from the beginning. But more importantly is institutions have to become intentional about the well-being of their staff members.
Yeah.
So I know corporates, some do like health checks every year, but they do that and they just put it down. They don't really use the information in there to say you have to do this or you have to do that. I remember about an giving information. And now a lot of institutions do these things where they send little leaflets because social media is great and say, make sure you drink water 2 times a day. Those are all mini bites. I call them enterprise therapy.
Like Korle PR unit has been doing, they'll send you the health tip for the day, for the week.
So those are all preventive. And usually, even if you look at chronic illness, including mental health related disorders, the same 3, sleep, exercise, and diet, are usually implicated together with any other therapy that is embedded. So for me, I only look at it from there. From the corporate level, which will normally translate into the individual. And with many of these practices, if you continuously engage in them, it becomes a habit. And there you don't struggle anymore. So I think that's something that must be looked at.
So Dr. Apiapipim, how do organizations do this? Sleep, diet, exercise. So as an institution, how do we do this? How do we achieve that? But before you go on, I want to acknowledge Bell Aqua for sponsoring this webinar series, also Maudeka Productions for leading the production for us and getting us to our audience, but also to our audience for taking time to join this discussion. Dr. Apiapipim.
Yes, so Dr. Asafo has said it all. But it all boils down to policies,
Right.
you know, at the workplace. If you go into an organization, so if you go to Rome, do as they do. If you go and these are the policies that you need to go on breaks. At 12, everybody should go on a break. I know it's not applicable to us health workers because you can sit in the consulting room for several hours. You're excusing yourself.
But we also need it.
Yeah, we need it. You're excusing yourself, and then the nurse brings a patient to you, like you don't even know what to do. I was like, I'm just taking a break. They don't understand that you should take a break and go and have lunch or something. I mean, it's not applicable. It's a bit difficult, but we can look at it. But other corporate organizations will look at it. Breaks, people should go on their leaves. Nobody should be denied leave so that they get to rest. There has to be retreats, relaxation, bring in therapists to help them relax and all that. Every quarter, you can look at that. I mean, if they have enough money. But all these things are enticing, and it also helps with the productivity of employees. There are some organizations that even have gyms, and people go to work early to use it and then freshen up and then work. It encourages them to even come to work early. So that is the bit that I can add. So it boils down on policies at the workplace, making sure that everybody goes by. If you do not, there are sanctions to it, so that you can put everyone in check to reduce the morbidity and the unproductivity associated with chronic medical conditions, including mental health conditions. Thank you.
But I think that management should first be very committed and acknowledge that the most important aspect of the business they do is the people, because it's the people that are executing these. Because if not, then we can have policies, but yes, the policies will just be in the cabinets and no one even checks, no one monitors. I am not sure, my supervisor knows the last time I took my leave or how many days, yes, but it's important that we need to get there and we need to be very intentional people managers at the workplace. Yes, AI is coming, but there are still some aspects of the work that needs people, and we need to prioritize people. Dr.
Yeah, just to add, physical activity has not just been identified as a preventive measure. In fact, because of the interest in physical activity, some research was conducted in Europe that took a prospective cohort. That means that people who didn't have the disease at the time that they were enrolled in the study, and after they were followed up with it for some period, and this involved over 10,000 people. And what they found was that in the period under which they were understudied, they divided these people into groups. The people who developed ischemic heart disease, or what is popularly called heart attack. And then amongst those people, how many of them had a mental health condition like depression, and how many didn't? And then they further interrogated how many engaged in low physical activity, and how many engaged in moderate to rigorous physical activity. So the preventive part is well proven, but now they looked at how people who are already employed and in the course of their employment develop these conditions, that's ischemic heart disease and depression, and they found out that there was a significant effect or difference between those who had ischemic heart disease but engaged in moderate physical activity. So as you talk about activity, there's a threshold. Threshold means is the minimum. So you are looking at least 150 minutes of aerobic activity. That is either involving 150 minutes per week. So you can divide it into 30 minutes each day, or you can have, there used to be an argument that if you did it in 2 days, it was not enough, but it's been disproven that as long as you have 150 minutes per week, it is equivalent whether it is divided proportionally or otherwise. But the point I'm driving at is that physical activity is integral in improving both the chronic medical illness of a patient and the mental aspect. And it is significantly lower compared to those who involve themselves in lower physical activity. And you can go above that. Many of us look at physical activity from just the aerobic aspect, but there are different types. So you can always, the preferred is having a combination of physical activity which encompasses the aerobic, that is the walking, running, skipping, and also the resistance activity, which involves lifting, because as you age, some of the challenges and risks that you face include falls. Yeah. So you need to build your muscles as you are young so that when the bones become weaker as a result of osteoporosis and other events, the muscles are well grown or hypertrophied to be able to accommodate some of these changes. So it's very essential. And to drum home about activity, and you are apportioning maybe X amount of money as per your insurance, and you didn't visit the hospital that much, the difference is given to you. And you see that it's a way of just making sure that people would engage in as much physical activity that would be included in the overall appraisal and not just what they were employed to do.
The task, right. Yeah. Thank you so much. It's now time to open the floor for questions. Our online audience, you can put in your questions in the chat box and we'll read them out. Any questions, please, you can ask them now. Dr. Anita, I see your hand up. Can we get a microphone to go around, please? Dr. Anita, if you can come to the stage, maybe.
Oh, sorry.
So good afternoon, and thank you so much for the panel discussion. It's really insightful and helpful to us. So I wanted this question to go specifically to Dr. Asafo. You mentioned something about some people being intellectually very good, but then their social lives are poor. So if you could expand a bit on the role of social life in managing mental health disorders. And then to the other panelists, I have other questions for you as well. Is there a role for activities that make people feel good? Like, for example, if someone feels good with music and has a mental health disorder, is there a role of such activities in helping them to cope? And then also, I wanted to find out, when it comes to workplace settings, you know, sometimes there are bullies. Like it could be your boss or other people, you know, those kinds of things. Is there a way, or do you think that, because, okay, let me put it this way. When you take corporate settings, usually when they say they are going for training, it's usually work or productivity related. The softest it can get is maybe they are training you on customer service, but it's all towards achieving the work. So when it comes to conflict management, team building, and all those soft things, do they have a role in helping? And then the last question, can you give any advice on how employees can stay within what they can cope with? So that if you don't keep saying yes to everything, and then you break down eventually. Thank you.
Okay, so I think Dr. Asafo, you can begin.
I don't know if this one is.
No, I can't.
All right. So I still feel like this is the prophetic microphone. So the context that I was creating was that in the modern world, especially among the more later generations, our quest for development has largely been intellectual. So one of the things that's consistently being hammered is go to school, learn. Go to school, learn. Play is almost non-existent within their scope of reference, which is why the social skills are underdeveloped. At the same time, the introduction of technology means that many people interact from the technological standpoint. And from what we know, many of such people, they have great online personas, but if they have to deal with people in real life, they tend to struggle a lot, which is why I say they are good with the head, but in other social contexts, being able to read the room, being able to identify other people's emotions, being able to communicate in an emotionally intelligent way is something they struggle with, which usually leads to the conflict. Now, you mentioned something quite interesting, and with the kind of work we do, we're always teaching these skills you are talking about. Conflict resolution, assertiveness training, emotional intelligence, resilience building, optimism. Like, we're doing all these things as soft and preventive approaches towards workplace and personal health decline. Now, we emphasize that well-being in module. You are able to stand up to your bully. And standing up to your bully is not shouting or screaming. It's about being able to communicate in a certain way, which is scientifically proven. So, for instance, from a science, we know if you're giving somebody feedback and you start, you, with a facial expression like this, the brain picks on the facial expression first. So it hardly follows anything that follows. So that also means that the advice or supposedly encouragement, but nobody is really hearing, because I look at your face, you're animated. I say, she's angry. So I'm seeing anger and nothing else. So in that assertiveness training, we teach people how to communicate into somebody's soul. Has anyone ever spoken to you and you've had goosebumps before? Yes. That's communicating to someone's soul, and it just has to do with the tone. It's the tone, really, that does that magic for a lot of people. So in assertiveness training, they are giving you work. You want to say no, but you feel like, I'll be doing bad. We have a three-pronged approach to that. First, acknowledge, and you say, oh, I really wish I could help. That's the first one. So you see, you haven't said, if you say typically, me, I can't do it, it brings conflict. Oh, Auntie Anna, I really wish I could join this panel. Unfortunately, there is something I have to do which is very sin. However, is there another opportunity for another time? By doing this three, you have made the person realize, oh, they really wanted to. So it changes the dynamic. And these are all skills that you can teach. I mean, as for psychologists, we believe that every skill can be taught. And neurogenesis is there to even prove that it is true. Thank you.
Right.
Sorry, neuroplasticity.
I believe your question has been answered. I think it's left with the music aspect. So I'll deal with it. So you are right. Music therapy has a role to play in the management of mental health conditions. So in our assessment of clients, we ask them, what are your hobbies? What are your coping skills? So if music works for you, then so be it. You would be listening to music more. But you can't go and prescribe music therapy to somebody who doesn't like music. That would be a stressor for the person. So it's individual based. Do you see? So it's very important to look at it. Music therapy has been implicated in the management of certain non-communicable diseases like dementia. You see the elderly people coming in, especially those in the Orthodox churches, they like to listen to hymns. And it really helps them with memories. And it makes them feel good. So it's important to use that if that is the person's coping skill. Thank you.
And I just wanted to add that, in fact, there are organizations that prioritize team building and other social skill activities. Unfortunately for us, Hollywood Teaching Hospital, maybe it's the number of staff that we have, over 8,000 people. But I think that departments can do it, because I know organizations that at the end of every working year, they'll go out for team building, and they'll even rotate the teams so that you know by the end of, maybe if you're there for 5 years, you know everyone. Even if in your working activities, you will not meet them. But because of these team building activities, helps you to build skills, just play. And for me, I am an advocate of play. Whatever my daughter does as play, I also do it, because it helps my mental well-being, it helps with my resilience, it helps me in managing my stresses. And so I think that we shouldn't also be too grown up to play. Yes, it's very, very important when we want to manage our mental stress. I have two questions online, so before I come back to the floor here, let me quickly take them. Someone is asking, regarding excuse duties for chronic diseases, is it required for doctors to state the diagnosis on the forms? Some patients ask for it to be written because their places of work require it. So let me ask the second question so that you can answer both. So this person mentions, Dr. Apia Pepe mentioned the Mental Health Act protects employees and states that employees with mental health issues be reassigned after receiving the appropriate mental health care. I would like to know if this applies in the situation where the employee canceled the mental health condition, or no, concealed the mental health condition during the pre-employment medical examination, even though they...
They'll just Google it up and, as to the culture of stigma and discrimination, prejudice and all that. So I always mention that if your HR wants to know, just inform, this is my email address. They can write to the hospital. I mean, the stamp is on, the name of the hospital is there. Yeah. They can write, and then I will respond appropriately. I don't know about the family physicians.
Many a time, I think a patient would rather you wrote it, but it is not advisable because we live in a day and age where social media abounds, and the same excuse duty could land in a wrong hand, and the next time it's being used against you. You can't tell what people can do with it. So it's better, like she said, it's not a far departure from what is done in other chronic medical conditions. It is the person's confidential information. And even when they insist, it's the reason they give me. If they told me it's because their boss asked for it, then I'm even more emboldened not to write it. But if they wanted an official report, and I think something similar happened on Friday, so we had to say, okay, put in a letter. Because in that case, it doesn't come to me as a doctor. It goes through the head of the department, and then we sit down and decide what to put in. Because you can never use somebody's information again, like we explained earlier on.
Right. Thank you very much.
Okay, the question about the Mental Health Act, employment rights, that the person concealed it. But if the person concealed it and is exhibiting signs and symptoms of a mental health disorder, then the employer has the right to send the employee for mental health assessment before they can do anything. You don't just say that because you concealed it and you are unproductive because of your mental health condition, go home. It is not right. I mean, if people really had money, Ghanaians had money, a lot of companies will be sued. Because this is a law in Ghana, the Mental Health Act. It's even a law now, but how many of us even know about it?
Aware of it.
So it is not enough to say that because you concealed it, you have deceived us, so go home. No. It's not right. It's like saying that somebody concealed that they have diabetes, so they should go home. You don't do that for diabetes, don't do that for hypertension. So why are you doing that for mental health?
For mental health.
So we should look at it. Thank you.
Right. Thank you very much. I still want to acknowledge our participants who have joined us online and in-house for joining the first Korle webinar series for the year. And today we have been discussing managing mental health and chronic illnesses at the workplace. We have some few minutes to go. I can take one question from, so I see a hand here. If we can get the microphone to her, please. Should be. So once we are done answering those questions, we can give our last words as we wrap up the discussion.
Hello, good evening. Thank you so much for this educative webinar. I have 3 questions.
If you can, please, closer to your mouth.
All right. Yeah. Dr. Safu, on so many presentations, I hear people say if people have anxiety problem, but you are medical expert. Some of the medications, life-saving medications you put your patients on, is written there by the clinical pharmacist that this medicine will give you anxiety. Personality types. Some are extro and intro. If you are quiet, you are sick. If you speak your mind to avoid depression and problems so that I won't get hypertension, you are mad. What will you tell staff, Hannah and Dr. Safu? What will you tell staff who goes about declaring people that, oh, they are not papa? Meanwhile, the person hasn't gone to see any psychiatric to, is it fine? Then some of our schedules are so stressful. You need to meet deadline, like the profession I belong to. By 31st December, you have to do this. You have to send this to the ministries. You don't have any option. It's already stressful. And you have staff in a team, they don't care. They will not contribute anything, but you are taking everything. 13, we all take the same thing, but they are moving around in a team, and you need to manage others. What can you do to help those who are stressed out of this work?
The work, right.
Thank you.
Thank you so much.
So, you know, the interesting thing about what you just said allows us to make a certain very critical distinction. You see, a lot of the times, I think people confuse mental health and mental illness, which is where the problem is. Now, if you look at mental health, it involves the way we think, and most of the time, the person on the street who is unkempt, it's usually that thinking faculty that's usually implicated. But mental health also includes our feelings. And many people don't look at that. So I could be an angry person. I'm always angry very quickly. That's in mental health. I could be a very shy person to the point that I can't stand in front of people and I'm shaking all the time. That's also part of mental health. Then it comes to now our ability to deal with stress. Now, what you describe about what you have to do in comparison with what people they don't care, means that you are dealing with a certain significant stressor. And the question is, how are you dealing with it? I don't know, but I'm just saying something. Now, for many people who give summary conclusions or judgments on mental health, it's because they are ascribing mental health to mental illness, and it's not the same thing. We all have mental health, but we all don't have mental illness.
Yeah.
There are days in which we wake up, we don't feel our usual selves. I mean, you are not feeling 100%, but you are not sick. It just says that if it's on a scale of 0 to 10, that day you are not at 10, you are probably at 3, but you are not sick. Same thing happens with our emotions. Now, when it comes to anxiety, anxiety is an offshoot or an offspring of fear. And we always explain anxiety in the context of the future. So, but there are 30 days yet to come, and I'm not putting that in context. So I'm thinking about the future, and what the future is doing to me is it's making it harder and harder for me to recognize that there are still things I can influence in the present to be able to achieve that particular goal. Now, the issue about the workplace dynamic is important, and I think this is where we as individuals must make requests. That's the first part. But the second part is that employees and corporates and institutions must also be proactive to know that things like this happen all the time. In fact, wherever there are multiple people, it also means we have multiple ideas to achieve the same goal. And that would definitely bring conflict. But by proactively doing something on managing or resolving conflicts, it eases that kind also. Now, what we know about temperaments is that temperaments are our dispositions which are biological. So we are born with temperaments. However, the fact that I am born with a temperament that makes me an introvert does not mean I cannot become an extrovert. Because the environment equally what?
Its influences.
Works on our temperament. So we psychologists tend to deal a lot more with personality than temperaments. And the personality is the sum total of your experiences together with your biological disposition. And we are of the view that you can build skills into people that allow them to be balanced regardless of where their temperament is built. Thank you.
Right. Thank you so much. I hope that was supposed to be my last question, but I see a hand there. I hope it's really brief. Can we please get the microphone to him? So while we try to do that, yesterday when the advert was posted on our Facebook page, I saw someone write a very long comment, which is interesting. I actually captured it so that I read it here today. So he says, many of your health workers, because Korle Teaching Hospital posted it, many of your health workers don't have support system for them. coupled with work politics, power play, etc. Your health workers are reeling under mental health conditions, and there's no real intervention to help them recover and back fit. Health workers are one of the, Health workers are one of the neglected workforce when it comes to wellness and well-being interventions to assist them remain sane at the workplace. Question is, what tangible support system do you, Korle Teaching Hospital, have to support your workers, especially nurses and other medics? How is it that nurses have to pay out of pocket for treatment at the hospital they work in? These and many other cases for poor welfare incentives, interventions are the conundrum many health workers face daily. So it's interesting because Korle Teaching Hospital in July last year launched the Employee Assistance Program, which supports our staff who have any problem at all, mental health issues, personal issues, family issues, work-related issues that borders on their well-being and job performance. And as you can see here, this is also one of the ways that we are advocating, creating awareness for that support and what can be done in our workplaces to support our staff. Again, it is important to state that Korle Teaching has a Medicare system here that supports our staff who are unwell. So the Medicare will cater for their health expenditure, and the polyclinic executes this, and where you go and you don't get an intervention there and it's justifiable, you get repayment. And so Korle Teaching Hospital has taken that step in supporting employees. I think what I can say might be the issue of awareness. And so we are trying to create a lot of awareness that the support is there and it is free for our employees to access the service. Thank you very much. Now we can take the question.
Okay, good evening. Yeah. My question will be based on a scenario or a certain instances that I have seen in a certain hospital that starts with K. I don't want to mention it.
There are two hospitals that start with K.
I know of a certain young nurse.
Please, if you can put the microphone.
I know of a certain young nurse in this hospital who has about 7 children. Unfortunately, the husband died. And she's left with all these children to take care of. And she works at the intensive care unit. Sometimes you see her sitting very absent-minded. Obviously, you can tell that she's going through a lot. I mean, the stress from working at intensive care, and then when you go home, stuff like that. For such a person, how do you advise him or her? How do you tell her to sleep, exercise, and diet? So I want you to expatiate on these preventive measures that you gave to such a person. Thank you very much.
Right, thank you for asking our last question for us. I think
so I would like
any
to take
of you can start.
Like I always would preempt or start with is we need to know more about the patient, because the same situation or the same preamble can exist in another patient who has sufficient family support.
Yeah.
And I also know that perhaps the husband may or may not have been in a situation where they left enough resources. So it is always better to get more information so that you don't stick to just the biological diagnosis. Like I explained earlier on, there's an individual diagnosis where the patient will tell you, my fears are the fees. My fears are the fact that I don't sleep. My idea about what I'm going through is that if I could get only morning shifts, I can get to pick up my children. So it is not always simple. And the contextual diagnosis is also the family support. You can get, especially in our culture, you can get an uncle who will say, give me one of your children. I like the girl. Give me. So in family medicine, that's what we do. We do a comprehensive care, and you find out that the patient may not even have put their minds to some things, but around the person, not external support. If you put what we call an echo map, you realize that there are people or support systems that the individual can draw from. Maybe an aunt even wants a child to live with. this child of maybe one of the children has finished SS and doesn't know what to do. So we always want to narrow down into what the patient is involved in. I would like to take the exercise part, and I'll give you the other aspect. So I say we need to speak to this person. It will be good so that this does not become just, in quote, a talk shop. You can give her the details and we'll refer appropriately to the polyclinic, because that's what we do. It's comprehensive care. We give the biological diagnosis, but we also want to understand the individual for who they are and other factors surrounding the person. And when I talk about exercise, we know that well over 3/4 of adults do not even meet the minimum criteria of 150 minutes of aerobic activity in a week. So there are domains of exercise, which means there are several ways of meeting that need. There's what we all know, but call it the gym. That's the leisure domain. So you go out of your way, go to the gym. But there's another domain which is called transportation. So if you live in the flat and you think you are not going to be late and you can walk within 15 or 20 minutes, remember that is 20 minutes of what you should have done in 1 week. And then there is also what is called the domestic domain, where whilst in the house, lifting the curtain, weeding, planting something. So exercise is not typically going to the gym, because many of us equate exercise to going to the gym. It is a broad thing that encompasses physical activity. So you have the transportation domain, which is walking from one point to the other. And even at the workplace, if you move from one place to the other, it's also counted as part of your expenditure of energy. Then you have the workplace, which we all overlook. And I think Dr. Pepin was making allusion to that one earlier. Even though you cannot take 1 hour break or 30 minutes break, especially because health workers encompass all of us, administrators, accountants, ambulance drivers, the people who work at the mortuary, the nurses, the doctors, the lab technicians, among others. You can take a break. And this is even more difficult, because as I talk about break, maybe the next break I'm on my phone. That is no break.
Yeah.
So you may have to switch off your data, put your phone on silent, and then it can be 5 minutes. It's an accumulation of that break, stretching and building up to the 150. Because it's quite difficult to get anybody in our system to have 150 minutes of just going to the gym or something like that. So that's to answer your exercise aspect. And also to answer the fact that to see this person holistically, we need to get more information. But I'll leave maybe the mental aspect. And
okay, so if you can also be brief for me, we are about 10 minutes over time already.
So it's important that you have identified that this person has a problem, but we need to have, buddies and support groups at the workplace. So you may need to find somebody whom she is very close to. If you are the one, then maybe you can take the bold step, discuss that, oh, I think that you look stressed. Don't you think that you should speak to someone? Do you see? So that can also help, because I see a lot of supervisors, heads of departments coming in, matrons, coming in with their staff that we think that she needs help. They hold their hand, bring them to the Melody Psychiatry Department, because sometimes it takes a lot of confidence to actually fight that denial and then come to the psychiatric department because of the stigma too. So if you get somebody, a buddy, a support system at the workplace, it helps. So it boils down to the fact that we have to form some what we call the mental health champions, support groups at work, people that you can trust with your information. Then you lead them to the appropriate professionals to help them in that regard.
Right.
Thank you.
Thank you very much. It's time to wrap up. So we'll begin with Dr. Opare, but there's a comment online that I wanted to, a question. In your wrapping up messages, conclusion, you can touch on it. Someone is asking, how do you deal with the issue of denying a staff's promotion due to the fact that that person is perceived as a drug addict, even though they have been visiting the addiction unit? When it gets to promotion, they are not given the chance to attend an interview. We are far behind time. I know the conversation is very, very interesting, but we need to go. Let's wrap up, and if you can touch on this, let's do that. So it will go in that order.
To the best of my knowledge, if this questioner is coming from Korle, I know there's usually an annual announcement about when promotions are done, and usually they will be signed off by the head of department and interviewed by an independent panel. I don't know at which stage this apparent promotion has stalled. I don't know whether it's unsuccessful at the interview level or it's not even signed off. If it's unsuccessful at the interview level, I believe they may have to, I'm not too privy to the information, but they may have to seek more information from the HR to get specific feedback. I know that's the beauty of interviews. You are giving specific feedback as to your performance. It's easy to allude to the fact that it has to do with an addiction. It could be that on that day, and we know we are here, that anxiety can play into it, and maybe even the answers that they know are not easily given. So we need to, and I think it's a good platform and it's in the right hand. You may have to follow up on this particular person. My take-home message will be that there is a proven association between mental health and chronic illnesses. And in this same vein, there is also intervention, which includes, if you're a Korle staff, coming to the polyclinic to assess your Medicare and having this comprehensive outlook to your well-being. But we should know that one of the things we have to do, aside the employee, the legal aspect, is what we call duty of care. You as an individual have a duty of care for yourself just as much as the employer has a duty of care. It may not be legal, it can also be ethical, where there's this kind of bi-directional relationship. My last but not the least is to say that in our work, in our practice of work, work itself imposes some psychological and physical risks. The psychological part has been said several times in the form of what we call the quartet of work stress. That has to do with the high demand, high effort, low reward, and then low control. But the physical aspect of our duties, where you may be standing for long, sitting for long, and you may not have had a chronic condition, but if you are an ex-staff working in the lab, working in the theater, working in the consulting room, working in the accounts office, and you sit or stand for long, as a result of this long exposure, you may be predisposed to having long-standing musculoskeletal issues. Yeah. And that is where we want to hammer that. You would have to be intentional about ergonomic breaks. Make sure that if your chair is not working, report to your direct supervisor. Take breaks. And I don't mean breaks where you chit-chat, but take a break, at least some 5 minutes, so that, like, we are going to end the program. We've sat for more than 1 hour, so that we give ourselves a break, which gives less chance of you developing certain chronic musculoskeletal condition. Because at the polyclinic where we run the staff clinic, it is one of the top 3 diagnoses that we have. Aside hypertension and diabetes, musculoskeletal disorders account for a sizable proportion of conditions that we see. And once again, thank you for having me this year.
Thank you so much, Dr. Appiah-Pepem also.
Yeah, I believe that this has been a very informative session. I have also learned from my co-panelists, and my take-home is very brief. I'm a woman of few words, so, so it's important that we look at the mental health domains of chronic conditions. And even mental health condition itself is also a chronic condition. And all that we are saying is that the employers should look at mental health policies for their employees and have to be abreast with the mental health law of the country, which is in tune with the labor law, so that if you are confused about anything, you don't take decisions on your own. You need to refer to the experts, and then we can give you the professional advice that will suit the employee. Because we have to bear in mind that we are all breadwinners in one way or the other. And once that someone is unproductive and the person is laid off, it affects their families and then people around them, I mean the extended family at large. So it's important that we look at the mental health aspect of chronic condition, including integrating mental health screening in health screening. I think that in recent times we have done so well. The public health units, I mean, Korle at 100, they invited us, you know, look at the mental health aspect, screen for depression, anxiety, stress. And I mean, sometimes people just brand it as, I am stressed, but beneath it is a serious psychological problem. So I think that we are there. We are getting there, but we have to do more in terms of awareness creation and being more proactive in this area. Thank you.
Thank you so much, Dr. Appiah-Pepem. Dr. Asafo will conclude.
I want you to look at your health, both mental and physical health, like your phone. Okay. Most of the time, we all have screen protectors in the beginning. And as they start to wear out, those that change it regularly will have their screen intact. Those who don't change it regularly, at some point, it will affect the main screen and it goes off. Same thing with our health. Things start to go out of balance. It's our job to ensure that we are maintaining, to give us some speed. I mean, whatever it is, the decline, whether we like it or not, it will come. But there are ways that we can forestall the way that it works. So be intentional. Do the things that allow you to get at least more mileage on your engine than to say, oh, the thing. So be intentional about it and maintain your health. Thank you.
Thank you very much. And that was Dr. Seth Asafo, a psychologist and lecturer from Ghana Medical School, University of Ghana Medical School. Dr. Apia Pepem, also psychiatrist with the Ghana Medical School, University of Ghana Medical School, and then the psychiatric Department of Korle Teaching Hospital. And then Dr. Ernest Opare, also from Family Medicine, Korle Polyclinic, join in this discussion. Thank you so much, our in-house and online participants, for joining us. Apologies, we are a few minutes behind time, but yes, you can see that this is a very interesting conversation, and yes, we need a break. Other than that, we could have gone on and on and on. Thank you so much. It's the Korle webinar series, the first in 2025, and next month we promise to bring you the next series, also interesting discussions like this. We are grateful to Bell Aqua for supporting this. And Bell Aqua says, when you take a break, take it with Bell Aqua. And so you'll be going home with parts of Bell Aqua water. But I also have personally some gifts for you, because I told you, I promised you chocolate. And then Maudeka Productions also for streaming this live on our social media platforms. Thank you so much, PR unit of Korle Teaching Hospital, for doing all the running about and getting us here to discuss this relevant topic. And so we say goodbye to all of you, and make sure you take very good care of yourself and your mental health. Right. So if I can get...
I was diagnosed with bipolar disorder, but the diagnosis came in August 2015, but the depression and the symptoms started in March of 2015. So I had ended a relationship, and it took a huge toll on my mental health. I did not know anything about mental health, so I thought what I was going through was normal. I should be feeling sad. I should feel like staying in bed was normal, just sleeping it off. I just felt that was symptoms of broken heart. Prior to my diagnosis, I was a student at the University of Ghana. I was studying French and linguistics, and I was hoping and praying that one day I could be a bilingual secretary. Life was a little different because I did not have to take medications for my mental health. I did not have to attend review appointments. I did not have to try to make sure I do not relapse. I did not have to overthink certain things. I do these things now to make sure that I'm stable and healthy.
Esinam first came to our facility in 2018. As you know, she's a young girl who had been diagnosed with bipolar previously and had attained some stability. Disturbances and things like that, and all these things were impairing her functioning as well as her social relationships. So we admitted her at the time because she needed an inpatient, intervention.
I did not realize I had bipolar disorder because I did not know anything about mental health. So when the symptoms started, my mother took me to different churches for me to be prayed for, and the pastors said different things, so it looked like it was a spiritual attack. So when we were going to the churches and we were not getting like a permanent relief, that's when my father said, no, we need to seek professional help. And even the first psychiatrist I saw, he said I had schizophrenia, which